Good afternoon, everyone. Thank you for joining us today. This is another a session in our series of Northern Michigan University Chat with the Cats. We're really glad that you're here today. We'll get started in a few minutes. People are coming into the session right now. We've got a lot of people registered, which is really exciting. So we'll wait just for a few minutes as I see those number of participants climb, and then we will get underway. Hope the day is going well for you. We started off soggy and foggy here today in Marquette, Michigan, but it is starting to clear up a little bit. And now we're looking forward to, I think, a little snow in the forecast in some parts of the UP, but not right here in Marquette. So that's good. Our numbers are continuing to climb, and we're glad that you're joining us for this session of Chat with the Cats that is focused on health and safety and support for our students. And we've got a panel of experts here today. We'll introduce them in just a minute. We invited parents and advocates of students to this session, but we know there are some students attending as well, which is awesome. And we're glad to get your questions and also relay lots of information today. So it looks like the numbers are just about there. Again, welcome to this session today about support for our students and our panel of experts this afternoon. My name is Jerry Daniels, and I serve as Executive Director of Admissions, and it's my pleasure to be the moderator for today's session, which what I like about that is I don't have to know anything. I can rely on the experts, and I can just toss all of the questions to them. And they represent a whole force of people here at the university that are behind student success. So we should have a good time this afternoon. You should also know that we're a pretty informal bunch. So we will probably joke and laugh a little bit, but we realize that this is a series of serious topics that parents and others are especially interested in. If you have any questions you'd like to ask the panelists, you can type those into the Q&A feature at the bottom of your screen. If you have anything of a private nature, you could also email us at admissions@nmu.edu, and we'll get you connected back to the proper resource after the panel. The session is being recorded, so if you need to drop off early, or if you want to go back and reference something that you heard, or share the link with somebody else who you think might want to see it, we'll be posting it on our site within the next week or so, and that will be at nmu.edu/support, which is also a webpage that I recommend that you check out as well. So let's meet our panel of experts. They represent a variety of areas on campus, like I said. I'm going to ask each to introduce themselves, describe their position at NMU, how long they've been at Northern, and maybe a brief rundown of the services their department provides. And lastly, a fun one, their favorite activity in Marquette. So Chris Greer, why don't we start with you?
Okay, hi everybody. I'm Chris Greer. I'm the Assistant Vice President and Dean of Students here, and I oversee a lot of different offices. So advising, housing, career services, student activities, the Dean of Students office, and in the Dean of Students office is conduct, disability services, veteran services, student support services, the food pantry, and first generation. I don't think I left anything out, but I'll be corrected if I did. I've been here 19 years, which is I did that because it's the longest I've been anywhere. And I didn't think I'd stay this long, but it's a great place. And my favorite thing to do, honestly, is to just be by the water. Even when it's frozen, you know, these daily walks on the beach are what kind of keep me going. So that's me.
Thanks, Chris. And I think we'll go from Chris to Christy. Christy, you're up.
Hi, everybody. I'm Christy Hartline, and I'm a licensed clinical psychologist. And my main position is at Northern's Counseling and Consultation Services. You'll hear me refer to it as the Counseling Center for short. And at the Counseling Center, we provide free, confidential, short-term counseling for all enrolled NMU students. Even if the student is part-time, they're still eligible for our services. And my main duty within my position is conducting therapy with students, whether that be individual therapy or group therapy. I have been at Northern for 6 years, which is actually the longest I've ever been anywhere, and I plan on staying. Rundown of the services at the Counseling Center. So first and foremost, we do individual counseling. That's the bulk of what we do. And like I said, it is short term. So usually how I describe that to students that I'm working with is I'll say, we don't have a session limit where we're going to cut a student off or anything like that. But in general, we see students up to around maybe 6 sessions in a semester. And within that time period, if we can tell that the student's going to need a lot longer term services, like a semester, 2 semesters, we're going to try to help refer them to another provider in the community who does those services. But in general, most college students actually can get what they need in short-term counseling. We also at the Counseling Center work closely with the Health Center, which we have someone here today from that office. And that could include referring students over there to explore possibly looking at psychotropic medications. We do group counseling, and we also do consultations. So what that means is sometimes students don't feel like they need our services for themselves. They feel they're doing pretty well, but maybe they have a friend or a roommate who's really struggling and they don't really know how to help them. So they could consult with our office, kind of get our advice and our guidance on that. And along with that, the NMU's faculty and staff also consult with our office. So a lot of professors are on the front line with students, and they're the first ones to know if a student's struggling. Maybe a student writes about it in their English paper, and the professor will call our office and ask how they could help that student. We also do outreach as well. So as time permits, we'll go and present to different classes on different topics, such as test anxiety. And my favorite activity in Marquette, definitely being on our pontoon boat. I love the water, and also bike riding.
Awesome. Thanks, Christy. Trisha.
Hi, everyone. Trisha Bush. I'm the Associate Director of Campus Rec for the Department of Intercollegiate Athletics and Rec Sports. I have the privilege of overseeing 2 campus rec facilities, one being the PEIF facility and one being the Satellite Center, the Wildcat Fit Zone. We have aquatics, fitness and wellness, climbing wall, an outdoor rec center, an equipment rental program, intramural and club sports, American Red Cross programs, and also some youth recreation for the community. I started out in campus rec as a student office manager quite some time ago, but I have almost 19 years. Chris, I've almost got you. A couple months shy of 19 years full-time here at Northern. So very happy about that. I would say my favorite activity, most recently, I'd have to say cross-country skiing. Because of COVID and the pandemic, outdoor activities in the winter was what I kind of jumped to, stay sane along with everybody else. So I bought myself some cross-country skis and picked that up last winter and also again this winter. And it's been beautiful. After a fresh fallen snow, I highly recommend it here in Marquette.
Nice. Very good. Robin, let's go to you.
Hi, my name is Robin Aho, and I'm the medical office manager at the Health Center here on campus. I've been here for almost 10 years. May will be 10 years that I've been here, and it's really gone by fast. I like seeing the other panelists on here. I get to work with them in some shape or form, and that's one thing I have to say about Northern is we have a really good team and lots of resources right away on campus. So the Health Center has a pharmacy, a lab, and a clinic. Our medical director is a board certified family physician. He had some ER back experience, so it's nice having somebody that's got that well-rounded for the medical director. And this past year, he's been very heavily involved with Safe on Campus and dealing with the pandemic. And I feel very lucky that we have somebody of his caliber being our medical director. Our other physician is a family American board certified family physician also, Kayleen Papin. So two MDs and a family nurse practitioner. And we also partner with the School of Nursing to have 3 nurse practitioners that come through the academic year and fill in on 3 days for the week to help us offer more support for seeing the students and faculty staff. We do a lot with the immunizations. There's a measles requirement that's part of the thing that we take care of. So at orientation, you'll hear some things about that. And we're always willing to help. If students need another immunization along the way, we can help them. Otherwise, to just collect that information to make sure they don't get a hold on their account for the measles. There's a grace period for the first semester, but it is due by the second semester. So we do like to help with that. And as Christy had mentioned earlier, we work a lot with the counseling center. If a student needs to have medications, we can work together to help with that. If a student has medications that they need filled while they're here, the pharmacy can help. They can transfer prescriptions or have a physician here follow up with that. The only thing that we don't do is the ADD, ADHD, but we do work with, we have referral sources, or if a student has a relationship at home, we recommend that they keep that. And but we can certainly help with it. The pharmacy can fill those medications, or we can help with giving some resources in the community. We see we're basically a family practice office. Right now with the pandemic, we've been everything by appointment, from the nurse visits to the lab visits to the clinic appointments. We jumped on board like a lot of offices and got heavily involved with video chat. We've gotten to be pretty good with Zoom, as all of us have learned to do over this past year. And UpDocs is another form that we use, and that's also our patient portal. So students have a way to get signed up for a patient portal, and they can add people on there. With HIPAA, we do need parent permission to be able to speak with parents, but that is something that they can set up a portal so they can communicate with their providers back at home or with family members. We also have 3 RNs here. They've been really valuable this past year too, with triage and just answering questions. We've had a lot of people have questions with exposures and different things, and so they're always available for a consult on the phone or video, or many means to be able to answer questions. My role here as the medical office manager is to coordinate between those 3 departments. And also if there's just questions, sometimes people have some private things that they want to discuss, and I'm always welcome to discuss that and be able to help with forwarding on any questions to the right people. Like I had mentioned too, with Northern, we have a lot of departments that we can coordinate with, and between the various departments, there's a way to get an answer to almost every question. And my favorite thing in Marquette, I have to almost copy Chris and Christy, Lake Superior, whether it's going there for a walk or going there to take pictures, we're very lucky to have it in our backyard. Thanks, you.
Robin. Thank you very much. And Jeff, we saved the best for last.
Oh, gee, thanks. Hello, everyone. My name is Jeff Mincheff. I'm the deputy chief here at the police department, and I help oversee pretty much the operation of the entire police department, from patrol to investigations to our student employees, our Safe Walk program. We oversee all of the camera systems that work on campus, including all of the doors and the locks. And we pretty much work with every department almost on a daily basis throughout the day and the week. And we have a great working relationship with everybody. And so we're a police department. And my favorite thing is all the seasons, because there's something special in every part of it for me. So
that's great. How long have you been at Northern?
I don't remember. It's been so long. It was 28 years for me.
Awesome.
Wow.
Great. Well, thanks everybody. A reminder to our viewers that if you have any questions, you can type them into the chat, and we'll try to get as many of those as we can. I think a big theme that I see is about how NMU has adapted or reacted to the pandemic, and also what our plan is for the fall. So maybe Chris, would you want to start us off with some of that about the plan for the fall and how NMU approached things this past year? And then maybe Robin and Jeff, you could chime in too about some of the details of safety precautions.
Okay, well, our plan for the fall is to be face-to-face. So we're moving full steam ahead to be like we were in the fall of 2019. So we're hopeful that everybody will be back we're hopeful that we'll be able to vaccinate, that our health center will get vaccine, and that we'll be able to vaccinate anyone who wants it in the fall that hasn't already been vaccinated. You know, when COVID hit a year ago, I walked out of the office and said to my secretary, well, I'll see everybody in 3 weeks. And I've been home ever since. You know, we had no idea, but we quickly realized, well, not quickly, you know, by April, we're thinking, okay, this is not going very well. So we eventually got our act together, and we went from one task force that really started meeting before we closed about what in the world is this. And then we went from one task force to, I don't know, 15, 20 smaller task forces that took on everything from housing and dining to classrooms, from capacity of classrooms to all the plexiglass we had to order to make things safe in classrooms and offices, to COVID testing, to hand sanitizer stations and PPE. I mean, this went on and on. The detail that we needed to talk about was astounding. By July 1, July 15th, we thought we had it pretty well nailed down with all the task forces working. We hired an outside expert who actually was a pandemic expert for the Navy or the Army, can't remember. But anyway, he was a pandemic expert, and he reviewed everything that we were doing, which made us feel good, right? That we had an expert, that we weren't out in the wilderness. And then, you know, we opened a week early. We changed our calendar. We opened a week early. We did very gradual move-in. We tested everybody when they came to campus. You know, I don't know, our outbreaks weren't large. You know, we had a whole dorm set up for quarantine and isolation. We never got to capacity. So we were pretty happy with the way everything went. We're still testing. We test 300 students a week. And they're the asymptomatic ones. Symptomatic people are treated differently. They're tested at the health center, et cetera. So, and the athletes are tested, right, Tricia? My gosh. They're tested constantly.
Constantly. The ones that were in, a lot of them had the protocol that they had to test 6 times a week.
So we're doing a lot of testing. But we feel good with how things went this year, considering we were in the middle of a pandemic. Anything specific, Jerry, that?
Well, I think maybe we'll loop back to a few things in a minute, but maybe Robin, could you talk a little bit about the Safe on Campus from the health center perspective, like the role you've had, or anything related to vaccinations maybe? I don't know where you want to take that. Yeah.
And it's nice because there is the Safe on Campus website that comes up on almost every screen when you go to nmu.edu, and the dashboard is there if people are interested in the numbers. It's updated on a daily basis. So I think that's a really good thing with IT, and Northern have kept that up. Yes, as Chris had mentioned, we do the weekly screening. There's a random sample of students, faculty, staff. The president's really good about getting the emails out and the messages about getting a time slot picked to have that done. We do it every week, and we have it on our website too, the calendar out for the semester on when those days are. They were normally Mondays and Tuesdays, but this week it's on Friday, but we do have it posted out there. It's 1 to 4 every week. So we've been doing that. And Chris touched on too that there's testing available for the symptomatic people. We do have lab equipment that we received, and we can do same day results. Appointments need to be made, but we can do those. And then we also keep a list on our website, and it's on the Safe on Campus also, for the outlying areas that there's other testing things that are available if they can't get in, whether it's a weekend or a night or something. There are some other resources, but yes, we've all worked together to make sure to get that out there about the testing availability. And then we do a lot of video chat in case it's sore throat, mono, something else. You know, right now we all jumped to COVID. And so, but yes, we do help with the Safe on Campus dashboard. And again, questions for the nurses, we always can help with that.
Great. And Jeff, I know as we were gearing up for the fall, a lot of what public safety, the safety department helped with was all the walkthroughs of every single office and classroom on campus to determine spacing and capacity and all of those things. Do you want to talk about any elements of that?
Yeah, it was quite a task that was taken on. Our chief was involved in that pretty heavily, Mike Bath, and they went into literally every single classroom and lab, measured everything off, and then they designated where people could sit within the safe distance, which was required by the CDC. So it was time consuming and put a lot of time into it. And once the plexiglass stuff was set up, we had to go back through then, and we all participated in that to make sure everything was set up the way it was organized. And it's been working very well, very well. So yeah, it's been ongoing. And we also have the safety department that works out of our department here, and they provide daily basis of cleaning supplies around campus and hand sanitizer and stuff like that. So yeah, it's been pretty busy.
Yeah. Thank you. There's a few follow-up questions to some of the things we've been talking about so far. One is, does the university accept private or out-of-state insurances for students? Robin, that's yours.
We do participate with quite a few insurances, but we always recommend that before a student comes, that maybe call the number on the back of the card, just to make sure that it'll be covered while they're in Michigan. Sometimes there's a rider that you might have to get. Otherwise, we always will file a claim for every kind of insurance, but sometimes it does require getting either a rider or getting a slip back to get reimbursed. We do take health savings cards. We'll try to bill those if people have those. Pharmacy can help too. We take quite a few. We sign up with as many insurances as we possibly can, but it's always good to call that number on the back of the card.
Okay, good. And don't go away, because could you repeat again what immunizations are required before the start of school?
Sure. The only one that's a mandate is the MMR, proof of 2 of those. Usually that's given at 1 year of age and 5 years of age before you start public school. So most people already have that. And we do go through the Michigan registry and try to get those loaded. But Wisconsin and Illinois do have immunization sites that people can get that information, and they can get that to us. But yes, that's the only one that's a requirement.
Okay, great, thank you. And someone's asking a clarifying question. When we say weekly testing for students, does that mean every student gets tested every week?
Oh, no, sorry about that. It's more that one time during the semester that they come in and get a test. And if people need to get another one, they're welcome to have it more than once, but no, it doesn't have to be every week. It's just one time during the semester.
Okay. Another question has to do with comparing another institution where a student will be transferring from, where they've had to close their pharmacy and several of their health department services. So students need to go off campus using public transportation to find services. And so the person is asking, as institutions are battling falling admission rates, do you see this as a risk at NMU? And I don't know, Chris or Robin, I'm not sure who'd want to take that, but do we anticipate that any of our health services will go away?
I don't think so. No, if anything, I think we've amped up, and then we can help too. We're very much a office that can help with, if we can't take care of it here at the health center, we work with the outlying services to get people a referral, or yes, we get them taken care of. I don't see that going away.
Right, and you mentioned earlier that right now, during the pandemic, your services have been by appointment, but during pre-pandemic times and post-pandemic times, students are welcome to walk in as well, right?
Yes, we do appreciate the appointment. That does definitely make things go smoother. That's something that we've almost appreciated with all of this, how it's easier to schedule staffing and everything. But yes, prior to the pandemic, we did have a more open schedule for the immunizations or the lab services or blood pressure checks. Provider visits have always been, though, by appointment.
Okay, great. Okay, another follow-up to the immunization record. Does my student have access to upload her immunization record in her student account or health portal? Are incoming freshmen able to create something like that?
You know, that was something that we've talked about, and I think there may be one available. Right now we do have a patient portal, so if parents want to call, or while they're here, if they happen to be in the Marquette area, they can drop it off. Or there is, we are going to work at getting a portal that we can have immunizations uploaded to. That's something that we did see as something that we probably should get into place. With the pandemic, people were able to upload PCR results that they had at another institution or from home. And we found that to be really good logic. And we're looking at doing that for the immunizations going forward. But right now it is getting it to the health center.
Okay, great. And then what about prescriptions where insurance requires a specific pharmacy be used, like a CVS store? Is there a way to assist students with that? There's a lot of mail order options now. So, you know, sometimes that's how it may have to go. But again, too, sometimes when the insurance company knows that the student is away at school, sometimes there is a rider that can be put into place and it'll work at an outside pharmacy. And I know our pharmacy does work to try to make matching if it's an outside pharmacy to make sure that the pricing is the most reasonable for a student, especially if a student doesn't have a vehicle. We'll help in any way to be able to get them taken care of. Great. Okay, we'll give you a break for a few minutes, Robin, and kind of shift gears here a little bit.
Sure.
You know, we've all been reading about the impact of the pandemic and the resulting circumstances on young people's mental health and wellness. And the transition to college is always that, right? A transition, and students handle it in various ways, some very smoothly, some with, you know, a few challenges. But what kinds of resources does NMU have in place to support students, especially during their first semester? And then maybe also, are there resources or strategies that have become even more important during the pandemic? I don't know, maybe Chris, would you want to start off with that a little bit? Maybe starting kind of with orientation residence life, what kinds of supports there help with the transition?
Okay, orientation is kind of where we start. So now we love orientation. We love in-person orientation, but this summer we're still doing virtual because we don't know really where we're going to put that many people at one time safely. So we're doing virtual again, but that's where the relationships start. So during orientation, all of our new students will meet their advisors, their academic advisors. Every new student has an advisor in the Academic and Career Advisement Center, and they see those people for their first year. In addition, housing. If your student lives on campus, they will have an RA whose job is to make sure that the students are involved, because we know that involved students are retained students, are happier students. So they try to get them involved in house activities, hall activities. So that's one resource. Another resource is the resident director, who's a full-time professional that lives in the building. So there are two things. And then throughout the year, I think the students find that their professors are really good resources for them. And that, you know, when they're having an issue, many of the students will go to a professor to talk about what's going on and ask for advice. So that's another source of assistance.
Okay, terrific. And Tricia, you know, many times I think where students find their outlet for both, you know, getting involved, meeting others, and just to relieve stress is with physical activity. So would you want to talk a little bit about some of the services and activities in your area in a little more detail?
Yeah, definitely. I mean, physically active students are definitely going to sleep better, feel better, and function better. So we highly recommend getting involved in something. Over in our facility, it can just be as simple as coming in with your student ID, and maybe you're going to one day go on a treadmill and just walk, you know, just walk. We have TVs there, or they could bring their phone, their tablets, whatever they have, listen to music. Maybe some days they're going to try weights. There are the nice and easy machines where you just walk up and it tells you what to do on the machine, and you just adjust the weight and then you move it. We also have the free weights where they can come in if they're more of a regular workout type individual. Maybe they played high school sports and they have their own workout routines. So they can definitely get involved in a number of ways in that way in our facility. And then also our outdoor rec center has free equipment for students to use. So students get to use fat tire bikes, in the winter, snowshoes, cross-country skis. They can also get hammocks, disc golf sets. All of that is free for students to utilize. So they should definitely take advantage of that and go check out, you know, whatever interests them within those free items. Also, our outdoor rec center will lead guided hikes. So if they are brand new to the UP, never been here before, we obviously don't want them to just go trek out in the woods alone. So always, you know, find one of the guided hikes maybe to start exploring safely that way. Otherwise, if you are going on your own, always take a friend at least if you're not going on a guided hike, and let somebody know where you're headed. So those would be the safe ways, I would say, to get active.
Great. And we know that connecting is often a really important part of the transition to college too. So there may be a few of you who can talk a little bit about that, but maybe Chris, because of the Center for Student Enrichment, would you want to talk about that?
Yes, we do know that students that are connected to the institution are much more successful. So the Center for Student Enrichment, which is our fancy name for student activities, has a myriad of activities that students can get involved in. We have about 300 student organizations, and the great thing about our student organizations is that they want students to join them. They are not cliques. They actually want new students to sign up, and they recruit them. So it's very active. They do a lot through the year, a lot of activities. So that's really good. We have a number of great programs that students can sign up for and participate in through that office. So there's a lot that students can do. And you know, the interesting thing is, as a parent, and I did the same thing with my kids, you know, I was like, oh my gosh, don't get a job. You don't have time for a job. Don't sign up for 6 student organizations. You won't have time for that. Well, when you actually break down how much time a student has, and you take away the time for class, the time for studying, you know, 2 hours of study for every credit hour that they're in, more if it's heavy, you know, hard science classes. But if you take away all that time for eating, showering, and 8 hours of sleep every day, you still have 44 hours of usable time in your week. That is unassigned time. So you definitely have time for a part-time job. You definitely have time to be in 6 organizations and to go over to the PEEF. I mean, there is time in that week. So I would encourage you to encourage your children to get involved. And that's the way they're going to have fun and be successful.
That's great. And there's a related question for you, Tricia. Which club sports are available? Got the list in your head?
I have it right next to me. Can I cheat and list it, or should I direct them to our website? So for the most up-to-date list, I'll say go to our website, which is under Rec Sports. But quickly off the top of my, well, not off the top of my head, off my cheat sheet, alpine skiing, baseball, crew, cross country, cycling, dance, figure skating, hip hop dance crew, men's and women's ice hockey, men's lacrosse, Nordic ski, men's and women's rugby, sailing, men's and women's soccer, softball, frisbee, and men's and women's volleyball. In the current moment. So it could change, but that's where we're at right now.
And there'll be a quiz. Very good. We're back to another health question here, Robin. So we'd spoken about the only required vaccine being the MMR, but this parent has a daughter who's received the COVID vaccine. They don't live in Michigan. Should she somehow be communicating that to Northern, that she's received the vaccine?
Yes, and that is something I think that we're working on too with the Safe on Campus. After the break, there was a way for students to upload if they had a test or something done at home. We're working on that technology to be able to upload if they've had their vaccine. And for Michigan, we do participate with the Michigan Immunization Registry, so we'll be able to see that on file too. But yes, we really do welcome any incoming students to get their immunization record to us. That way, if they ever do need to utilize the health center, we have their record, whether they're from Michigan or another state. So yes, we'll have more on that too about the portal to be able to upload that over the course of the semester. We're working on that.
Great. Well, I know there's over all of time, as young people have gone away from home, there's often cases of homesickness that happen. And so I think several of you, talk with students about strategies for that. So maybe Christy, would you want to talk a little bit about how you talk with students when they're feeling homesick?
Sure. So homesickness is definitely a very common presenting concern at the counseling center, especially the fall semester, those first several weeks. So a really important part is to really normalize and validate that it's completely normal and okay. And you're, to be expected that you're feeling homesick. This is a major adjustment. And oftentimes I'll tell students, no other time in your life are you going to have so many changes at once. You're leaving high school, which you were with your friends for 12 years. You're leaving your mom and dad's house, your hometown. And now you're just being transported to somewhere where you don't really know anybody. So I normalize and validate their experience. And also I emphasize that it's going to be really important to help familiarize yourself with Marquette and the campus. And one technique you can use is to start making places on campus kind of your own. So I remember at my college, I had a certain booth in our restaurant at our college that was like my booth. And it just started to feel like home, kind of like when you go to a coffee shop and you have your favorite spot. So get your favorite spots around campus, especially students love Jamrich. It's a very beautiful building. There's lots of seating. Even if you're doing your homework by yourself, they like just having the feeling of other students walking by. And it's going to give them a sense of community. So familiarization, and of course, yes, connections. You want to establish a friend group. And what better way to make friends than to join the clubs or organizations or get a job? A lot of students do become friends with their coworkers. And if the student doesn't have a car, we have so many jobs on campus that they can apply to, and the jobs on campus are wonderful because they work around the student's schedule better than anywhere else will. So those are just a few off the top of my head.
That's great. Was there anything about residence halls you'd want to add, Chris?
The staff is trained to deal with homesickness, again, because it is so common, as Christy said. I mean, nobody, even though they may be cheering the whole way up here, when you leave, when you drop them off and you leave, they're sad. They may not want to admit it, but they're sad. And so the housing staff is very attuned to that. And that's why they try to keep them busy immediately. There's all kinds of activities happening from the moment they go into their room. There's stuff happening. And so that's one of the ways that they kind of take their minds off it, is by having stuff to do. I really think even volunteering, I thought of that when Christy was speaking. We have a volunteer center on campus where they can get hooked up with some organization off campus that needs volunteers, and students really start to feel part of the community when they volunteer. So that's another way to start feeling like they belong. So I just think it is so normal, and we all talk about it and help students through it.
And then there's a family weekend program that's offered midway through the fall semester too, right? To kind of connect students back.
Right. It's about 6 weeks in, which is perfect timing. 6 weeks, we really recommend that families stay away for 6 weeks, and that students stay here for the first 6 weeks, because that's when they get connected to the institution. And if you're up here every weekend, or they go home every weekend for football games, they're not hanging out making friends. they're not studying, but anyway, they're not making friends either. And so we really like that kind of 6-week rule. And we know that doesn't work for all families, and, you know, but that's our general guideline. So family weekend's about 6 weeks in, I think, in the fall. So it's perfect timing. So come up for that. And I always say to families, don't worry if you can't come. Not everybody's family comes up. So it's okay.
A quick question for you about housing, Chris. This person says, my child's rooming blind and won't know anyone. When will they find out their roommates so they can connect?
I believe the end of July. That's normally when everybody finds out who their roommates are. So,
right.
And social media, you know.
Yeah. And well, and through the portal, if they, you know, they kind of do some of the profile matching and so forth and find somebody, they would know and be able to connect before that, too. But that official notification at the end of July. We have a question for you, Jeff, regarding regarding cars on campus. And they've not been to Northern in the winter, but her car does poorly in the snow. It's a Toyota Prius. So they kind of expected to keep it at home. Is the campus and local community kept up pretty well? Because the car struggles even in 3 inches of snow. What would you say?
They do a wonderful job. First of all, on campus, our grounds department usually starts about 4 a.m. and start plowing the lots and stuff. By the time campus actually opens, everything is pretty cleaned up, and they do a wonderful job. And they have enough equipment to take care of quite a bit of snow. The city does a pretty darn good job as well. But I you know, a Prius front wheel drive, I'm guessing, you should be able to get around okay. They do plow the parking lots. Emails are sent out every other week, and students are given alternate lots where they should go park their cars. If they need help during the wintertime, you know, we have student employees that work here at the department that can certainly help out as well. I guess it depends on the weather. This year, we wouldn't have had a problem. So
I was going to add, my only recommendation for that is get one of those small shovels to keep in the back of the car, because just in case they go by plowing when you're in class and you need to get that foot out behind, or like that little bit, you know, that comes in behind your car so you're not stuck.
And definitely with a small car, move it when they tell you to move it, or it's going to be buried when you come back out.
Right. And then when on the day they move them or they move to a different lot, there's people there to help as well, to help get them moved. So
that's great. Well, we are coming up at the end of our 45 minutes, unbelievably. Oh, but another question just popped in. So before final thoughts, are freshmen allowed to have a car, and is there a fee for a parking permit?
There is. They have to register with us here at the department. The parking department is right here at the police department, and it is $140 to register your car. And then they will be assigned to a parking lot with, you know, they'll be given a map and stuff and shown where to park the car. Yep.
And that's for a full year, right? That parking
yes.
permit. Okay, great.
Correct.
And then you also register bikes as well, right?
Register bikes, yes, we do, and it's free. If they bring their bike in, we get their serial number, and we provide Northern stickers on them, and you know, they're registered pretty much for life. In fact, we returned a bike that was missing for almost 5 years, and the guy was excited to get his bicycle back. So we did do that. So yeah, it is a free service.
Yeah, a few more questions here, Jeff. You're a star now. First of all, just confirming, yes, freshmen can have a car. That was just another question, just confirming. So yes, any student can have a car. And then can you explain how the dorms are locked and what the ability to enter is, how that all works?
Yeah, the door, each student is you know, given their student ID card. Okay, and the doors lock, you know, and the hours vary depending on the time of season it is. You know, it gets dark earlier or later. But if the door is locked, the only thing they have to do is take their card and swipe it in front of the electronic lock, and it will open the door, and they can go into the buildings. So their card will be set up so they can swipe their card and into the building they would go. Is that
And then they're all their individual room doors are. And then in the woods, there's also, or in all of the halls, there's also separate doors into like their hallway. Is that right? Am I remembering that?
There is, yeah. When they go up, either they go up off the elevator or the stairwell, there's separate doors. But then for their rooms, they have separate rooms. You know, they share, you know, the centerpiece, but then they have doors on their own rooms as well. Yeah.
So the follow-up question, so at times are the dorms unlocked? Just concerned about safety. Are there times when they're unlocked? Chris is shaking her head no.
I don't think so. I think they're
no. They're locked 24/7 now.
Right, exactly.
Yeah.
Great. And here's a really good final question to end with that I will answer. It says, when should my daughter notify the school that she will be attending the school? Anytime is good. What we see as an indication of that desire to come to enroll at Northern is registering for orientation. So yeah, we'd love for her to do that and then register for housing too, if she hasn't done that. So thank you for that question. And this has been a great session, panelists. Thank you so much. You're a wealth of information and so appreciate the way you always are supporting our students every day. Thanks to our audience for sticking with us. Everybody except for 2 people stayed on the entire time. So I'm very impressed by that. And we're getting lots of thank yous in the Q&A. So thanks to all of you. And a reminder that this will be recorded and on our website, nmu.edu/support. Have a great evening, everybody.